High LDL cholesterol builds silently for years, promoting plaque formation in the arterial wall and increasing the risk of atherosclerotic cardiovascular disease. LDL particles are more atherogenic when oxidized or when chronic low-grade inflammation injures the endothelium, whereas HDL participates in reverse cholesterol transport. Diet, physical activity, sleep, and medications where indicated remain the foundations of treatment. The beverages below are supportive options that can be incorporated at night to align with circadian lipid metabolism and sleep hygiene. Overnight refers to steady, repeated use over weeks to months rather than an immediate change by morning. A warm golden turmeric milk is a calm, caffeine-free option that provides curcumin, the principal polyphenol in turmeric. Curcumin exhibits antioxidant and anti-inflammatory activity, helping reduce endothelial inflammation that promotes LDL retention and oxidation, and it may modestly lower LDL and triglycerides in some randomized trials when taken consistently. Curcumin is poorly absorbed unless combined with piperine from black pepper, which increases bioavailability substantially. Dissolving about 1 teaspoon of turmeric powder in a cup of warmed dairy or fortified plant milk and adding a small pinch of ground black pepper is a practical preparation. Cinnamon can be added for flavor, but the primary active is curcumin. Individuals with gallbladder disease, those on anticoagulants or antiplatelet therapy, and people scheduled for surgery should use turmeric cautiously and discuss it with a clinician. An oat and cinnamon soak provides soluble fiber, particularly beta-glucan, from rolled oats. Beta-glucan forms a viscous gel in the gut, binds bile acids, and increases fecal bile acid excretion, which drives hepatic conversion of cholesterol into new bile acids and upregulates LDL-receptor activity, lowering circulating LDL. A daily intake around 3 grams of beta-glucan is commonly associated with an approximately 5 to 10% reduction in LDL over time. An easy method is to combine about half a cup of rolled oats with water and a cinnamon stick in a jar, let it infuse in the refrigerator, then gently warm and drink the liquid in the evening. You can also eat the softened oats to receive the full fiber dose. Cinnamon contributes additional antioxidants and may help lower triglycerides, though effects on LDL are less consistent. Prefer Ceylon, true cinnamon, to limit coumarin exposure if used regularly. People on hepatotoxic medications should avoid large amounts of cassia cinnamon. Hibiscus tea, from Hibiscus sabdarifa calices, is naturally caffeine-free and rich in anthocyanins and other polyphenols with antioxidant activity that helps limit LDL oxidation and supports endothelial function. Small human studies and meta-analyses suggest hibiscus can modestly reduce total cholesterol, LDL cholesterol, and systolic blood pressure when consumed regularly, complementing broader cardiometabolic care. Steep 1 tea bag or a tablespoon of dried calices in hot water for 5 to 7 minutes. Its tart, cranberry-like flavor is pleasant without sugar, or you may add a squeeze of lemon. Because hibiscus may lower blood pressure and can interact with acetaminophen metabolism, people with hypotension, those on antihypertensive therapy, or individuals with liver disease should consult a clinician before daily use. A fortified yogurt drink containing plant sterols or stanols provides one of the most reproducible dietary LDL-lowering effects. Plant sterols/stanols are structurally similar to cholesterol and compete for incorporation into mixed micelles in the intestine, reducing cholesterol absorption and promoting increased LDL receptor-mediated clearance. Across multiple randomized controlled trials, a daily dose of about 1.5 to 3.0 grams typically lowers LDL cholesterol by roughly 7 to 12% within 2 to 3 weeks, with effects sustained during continued use. Choosing a low-added sugar yogurt drink that lists plant sterols/stanols and provides the target daily dose on the label is key. These products are adjuncts to, not replacements for, statins when statins are indicated. In fact, they can be used together to provide additive LDL lowering. They are generally well tolerated. Individuals with cytosterolemia should avoid them. and those who are pregnant, breastfeeding, or managing pediatric hyperlipidemia should use them only under medical guidance. Dill tea, prepared from dill seeds or fronds, offers a gentle, caffeine-free herbal option. Emerging clinical data suggest dill may lead to small reductions in total cholesterol, LDL cholesterol, and triglycerides, likely through a combination of antioxidant effects, minor inhibition of intestinal cholesterol absorption, and hepatic enzyme modulation. To prepare, steep about 1 tablespoon of lightly crushed dill seeds or a handful of fresh dill in recently boiled water for 10 to 15 minutes, then strain. Evidence for dill is less extensive than for beta-glucan or plant sterols, so it should be viewed as a supportive, well-tolerated option rather than a primary lipid-lowering therapy. Individuals with known apiaceae, celery, parsley family allergies, should avoid it. A decaffeinated green tea can be added as a special bedtime option. Green tea catechins, especially EGCG, have been associated with modest reductions in total and LDL cholesterol and with decreased LDL oxidation. For evening use, a decaffeinated preparation preserves much of the catechin content while minimizing caffeine-related sleep disruption. L-theanine in green tea may promote relaxation without causing sedation. Steep a decaf green tea bag in hot water and drink it about an hour before bed. People with iron deficiency anemia should avoid taking tea with iron-rich meals, and those with a history of liver injury from concentrated green tea extracts should avoid high-dose supplements. Standard brewed tea is typically well tolerated. These beverages work best when integrated into a comprehensive plan. A dietary pattern rich in vegetables, fruits, whole grains, legumes, nuts, and fish. Limited intake of trans fats, refined carbohydrates, and excessive saturated fats. Regular aerobic and resistance exercise, weight management, tobacco avoidance, and adequate regular sleep. For individuals with elevated atherosclerotic cardiovascular disease risk or markedly elevated LDL-C, guideline-directed medical therapy, e.g., statins, ezetimibe, PCSK9 inhibitors, or bempedoic acid, should be considered in consultation with a clinician. If you take warfarin or other anticoagulants, antihypertensives, anti-diabetic medications, or have gallbladder, liver, or kidney disease, review any new herbal or fortified products with your healthcare professional to assess interactions and suitability. Incorporating one caffeine-free option nightly, turmeric milk, hibiscus tea, dill tea, or an oat infusion, and consistently consuming a plant sterol/stanol fortified yogurt drink as directed can contribute to clinically meaningful incremental improvements in LDL cholesterol over time, while also supporting relaxation and sleep quality that benefits overall cardiometabolic health.